You're listening to Head On with your host, board-certified plastic surgeon, Dr. Bahman Guyuron.
Part of the reason that the eyes are in a position that they are and the eyes open the way they are is a combination of volume in the eye socket. Some of that volume is fat, and fat is absorbed or dissolved as a result of emaciation. The eyes are going to look hollowed, and that can happen as a result of aging as well. And the eyelids can look depleted. That is why the contemporary eyelid surgery includes injection of some fat in the upper or lower eyelids to restore the volume that is lost. In fact, if you look at the pictures of a lot of young, attractive individuals, they have fuller eyelids than those who have aged. And that used to be actually a part of aging that we could not, for a while, correct it. But for the last 2 decades, we've been able to improve that part of the eyelid also. Invariably today, those of us who specialize in the face and eyelid area do not do eyelid surgery without some restoration of the fat. So fat can be lost because of weight loss, can be lost because of aging, and we can restore that. And it may actually sound like oxymoron that we actually removing fat from one part and adding fat. The reality is that fat bags are in the wrong place. Well, we remove from that wrong place and we add fat below where they were creating the fullness. Because of fullness, they were creating a hollowing. And that way, we can actually create a smoother lower lid. Again, fat contains the stem cells, and the stem cells also rejuvenate the skin. Fat that we use to inject in the eyelids usually comes from the lower abdomen, where generally there is accumulation of fat that we don't need it. We remove it with a dull cannula or needle and remove from the abdomen, inject it in the area with a dull needle. So for fat injection in the eyelids, we actually don't need any cuts to be made anywhere. It is just the injection. In general, it's a very safe operation. And what we do is make it even safer by injecting the eyelids with agents that will shrink the vessels. Because one of the complications, serious complications of fat injection in the eyelids, and fat can get into the vessels and can damage the vision. But those of us, again, have a lot of experience doing this and know how to minimize that potential. In fact, I've been doing fat injection in the eyelids for over 25 years. Fortunately, I've never seen any visual loss in the eyelids, but there are reported cases in the literature that we know that that's a possibility, that fat can get into the vessels. So again, we shrink the vessels with the epinephrine, neosynephrine, and inject the fat, which will minimize the potential for fat getting into the vessels. Fat also can potentially be lumpy, meaning take irregularly. If it happens, it's correctable, or can be absorbed. We know that part of the injected fat goes away. So what we do is inject it a little bit more than what we need. And generally, those of us, again, have a huge experience in this area, have figured out how much we need to inject to accomplish the intended goals. For a consultation about blepharoplasty, you can call my office, 440-461-7999. Again, 440-461-7999. Or go to our website and That is Dr. Bahman Guyuron, one word, .com. And we'd be happy to offer in-person or virtual consultation. Overwhelming majority of my practice is from out-of-town, out-of-country patients.
Links to learn more about Dr. Guyuron and anything else mentioned on this podcast are available in the show notes. Head On is a production of The Axis, THEAXIS.io.